Okay, all yours, sir.
Okay, good evening. The November 6th meeting for the Budget Committee. And the first thing on our agenda is the meeting minutes from the previous meeting.
I'd like to make a motion to accept the minutes of the October 30th, 2013
So seconded.
meeting.
We have a motion and a second to accept the minutes of the October 30th, 2013 meeting. Any discussion? All those in favor say aye.
Aye.
Opposed? So moved.
I'm abstaining. I wasn't here.
Yep.
Abstaining. Can't talk either. Yeah, I just had one. Maybe I'll talk after this.
One abstention, Eric.
Good job, Catherine.
Okay, the next thing,
Little steps.
we have the Child and Family Services. It's, come on up and join us.
Another year, another
Yeah.
budget.
Yes. Ruth, right?
That's me.
Yes.
And Tony.
Yeah, and Tony.
Yeah.
Tony was here.
Yeah.
Yeah, we have a couple new members, so
Hi.
good to have you
You
in.
guys.
Okay.
Thanks, so you might want people just to introduce themselves.
Sure, we can go around, circle here, and
Stanley Brown.
John Bossy.
Jane Alden.
I'm John Scanlon.
Wayne Brock.
Eric Pyra.
Catherine Dawson.
I know you and I know you and it's not going to be, is not going to be a test, right? And this is Tony Cheek. He's our finance guy. Your letter said, bring somebody who can talk the numbers.
Good.
He's my guy.
Tony.
So Tony's also a resident of Guilford, so he lives pretty close.
And you're having a good budget battle in Guilford. You turned some money in last week, last year, and now they want more. Come here, Burgess.
This is our annual visit, and I think we asked for a slight increase in our allocation this year of $350, and that basically reflects some increase in services, especially in our family counseling program. We saw 10 families this year and provided 70 hours of family counseling. And basically what we're looking for is a gap figure. We serve families who are uninsured or underinsured. That may change once the Affordable Care Act goes wherever it goes, but currently insurance reimbursements that we get for these folks who have insurance average between $48 and $65 of reimbursement. And the fee for actually providing the kind of counseling that we provide to kids, which involves work with the schools, work with docs, work with families, it's a very comprehensive program, costs about $90. So there's a gap of between $28 and $35. And we do have a sliding fee scale, and some families can pay that, but others really can't. So that's really the nut of what we come to the towns hoping that you'll help us provide. The other program that we look for charitable money for is for Camp Spalding. We had quite a few kids from Tilton who came to Camp Spalding this summer. And actually I brought a couple of brochures with me that I hope you'll keep in the town offices with the human resource people, because this is a wonderful summer camp for kids. And it has enormous potential for turning kids' lives around. And I'm delighted that more and more kids are discovering it from the Lakes region, and partially that's happened through the WLNH Kids Auction, which provided a grant for us, and we could expand the number of kids. So it's, we've done a lot of recruiting, worked with a lot of guidance counselors and docs up here to refer kids, and the numbers are growing. Please.
Is it just for kids in need, or is it for
It could be any kid.
any child?
Any child could go. It's a normal camp. It's like, Camp Belknap, it's like Martina, except that it really focuses on making sure that any kid who wants to come to camp, regardless of their income, can come. So we do have a few full fee-paying families who send their kids, but mostly it's for kids who come from very low-income families.
No, they do a week program and a 2-week program, or is it all just
It's all
1 week?
2 weeks.
All 2 weeks now. So we're sending, if we send a child, they're guaranteed 2 weeks.
Right,
For
an overnight
outfits.
camp, and they get to go horseback riding and rope. They have a ropes course, swimming lessons, canoeing. We have an artist-in-residence program that's endowed, so we bring in fiber artists and painters and craftspeople to work with the kids. And this year, actually, this is the second year, we have a partnership with the Families Connecting program at the New Hampshire State Prison. And during the 4th session of camp, we have kids whose parents are incarcerated come to camp. And as part of their camp experience, they get to spend a day with their dad or their mom at the New Hampshire State Prison doing camp-like activities. Some of these kids, they haven't seen their parents in a year or two. And this is quite exciting. We had 13 kids this summer in the 4th session who had an incarcerated parent, and quite a few of them were from this area.
Yeah. Christine Tooth.
Yes.
She's a
I've
friend
seen
of
that.
mine, yeah, and I know the program. When she had it at Laconia, and then when Laconia closed, she moved it down to Concord. And
We
she-
serve as their fiscal agent.
Yeah, and she has really raved about the fact that she's been able to connect parents with children through programs like yourself, so I see this are valuable. I'm sorry, I cut you off. You were...
Oh, I was just going to ask, does it also serve children in need?
Yes.
Are there handicaps that they can't handle, that they're not equipped to?
We've had kids who are sight impaired. We're really not equipped to do kids in wheelchairs. If they have some type of walking disability, we do have 1 or 2 cabins that have ramps, but for the most part, because of the terrain, it would be tough to handle kids who are wheelchair bound.
Well, they'll take kids who are discipline problems, which
Oh, yes.
seems to be the rage,
I would say,
unfortunately.
I talked with our camp nurse this summer, and I would say 60% of, she said, over 60% of the kids are taking some form of medication for behavioral issues. So we take tough kids, and it's not billed as a therapeutic camp. It's mostly for kids whose families can't afford this enrichment program, but along with kids living in poverty, there are other issues that they develop.
They sometimes
Mental
go
health
hand in
issues.
hand.
They do go hand in hand. And if your family's under stress, if your family can't afford the rent, the kids get it. They feel it. They react to it. And so we have some pretty sophisticated staff who work with the kids in that.
It's excellent.
You said that there was 14, or 2 weeks of camp, but yet 20 individuals at 96 is under 5 days of camping.
I count all the folks in the family because I think we actually had 6 kids who came from this area, maybe 7. And there were 2 or 3 people in the family, the mom, another sibling, and they all benefit from the kid being at camp. We have kids parents who tell us after their kids come back from camp that, number one, it was a respite for them. They knew their kids were safe for that portion of the summer that they were at camp. And also the kids come back with better habits and better behavior and a stronger relationship with the family. So we see that all 20 family members benefit, even though maybe 6 kids coming to camp. Everybody in the family benefits.
Do you get a lot of repeat kids year after year?
Yeah, we do. I would say quite a few repeat, although this year, because of the WLNH Children's Auction, we were able to bring, I think, from the entire Lakes region. I think it was 23 kids from this region to camp, and 13 of them were brand-new kids who'd never been to camp before.
Am I reading this right? This has been, camp's been going on since 1944?
It has.
Do you ever get kids, or I guess they'd be adults now, that come back and share any success stories?
We do. One of our former campers is a member of Recycled Percussion. You remember a couple of years ago?
Yes.
They got to the finals in...
Yes.
X Factor.
The X, was it the X
No,
Factor?
it was America's Got Talent, wasn't it?
America's Got Talent.
Yeah.
Bob Tewksbury was one of our campers.
Yes.
We've had some really interesting kids come back. Chief of Police in Concord was a camper. Bob Hill, who he ran a very successful plumbing business in Concord, and then he moved to Epsom and became the police chief in Epsom. Gave up business and went into town government. So we've had some wonderful stories of people who come back over the years.
What is the normal rate for Camp Spalding? How much by a week?
For 2 weeks of camp, the fee is $900.
So if you-
Parents pay based on their ability.
Right.
There's a sliding fee scale, so the average family fee is somewhere between $80 and $120 for 2 weeks.
So if we were to take $800 as a base fee that people could not pay, so 6 times 8, which would be $4,800?
Right.
Just in Camp Spalding.
Right.
For the $2,500, we're getting $4,800 worth of that service. Now, Healthy Families, I believe, is an educational program?
Basically, we work with families, young women who are Medicaid eligible, very, very low income, under the age of 21, and it's their first pregnancy. And we do home visiting and help them have a healthy outcome for their pregnancy. We teach them good nutrition, we do smoking cessation, tell them about the dangers of drugging during their pregnancy and what it can do to kids. And they have healthier babies, and then we follow them for the first year of life. We do home visiting, we do well child checks, we do depression screening for the mom, and if there's any indication of postpartum depression, we then link her up with our counseling program. So there's a real fluidity to it. And that whole first year of life, as kids' brains are developing, we've learned a lot about infant brain development, that first year is so critical. You've got a mom who's much better prepared to be a mom, and much healthier outcomes for the kids.
And what is the fee to the parent?
And
No fee at all. Okay, so that actually is a volunteer service.
yes,
Okay, so what you're asking for, as I'm reading through this, is the $28.50 is for about $26,500 worth of potential services for the year. Good.
Ruth, could you elaborate a little bit on intensive home-based services?
again, this is home visiting for families, multi-problemed families, with kids who are at risk of being placed in out-of-home placement, foster care or group home care. And we provide a range of treatment options in the home, therapeutic counseling, drug testing. We track the kids. If they've gotten into any kind of trouble in the community, vandalism or breaking and entering, and are close to being adjudicated, we track them 24 hours a day to make sure that they get to school, they come home, we do random drug tests. We work with the family to teach them better child management skills and relationship issues. And so we have I've got any number of services that we can plug in based on what the individual family's needs are at the time. And the goal is to keep that family together, because it's so much more expensive to move a kid out of the home and put them in placement.
On your expenses on your sheet, is Camp Spalding part of the expenses?
No, it's
I
not.
was going to say.
Yeah, no, each town gets a little different format of the report, and I kind of inherited these a few years ago and haven't changed them. If you want to see other things, I can certainly provide it, but
No, I was
these
just wondering
actuals
how,
are just
you know,
the,
camp can have insurance for $600.
yeah. No, these are just the programs that we have specifically in the Lakes region, which are our family counseling program and our parent aid program, which we have separate accounting for, but all these other programs that Ruth has mentioned are not reported here.
Yeah, we have, Tony and I have to figure this out. We have programs that are statewide. Anybody can access them. So Camp Spalding enrollment is open statewide. We've got, our adoption program, for instance, is statewide. Our pregnancy counseling program is statewide. So we just prepared the budget based on programs that are specific to the Lakes region.
So how do people who are in need, how do they find you? How do they know about you?
We have an office in Laconia, at 719 North Main Street. We have our newsletters are in doctors' offices and at schools and mailed to the community. I think most communities know how to reach us when they need us, but
Doctors
and mental health
centers.
Yeah,
So a lot of referrals?
we get a lot of referrals from VNA, from mental health, from the schools,
Guidance counselors?
guidance counselors in the schools.
I think you work closely with our welfare director, too, Heather.
Yes, yeah.
Their number is one of the ones we have listed in the services available for the community.
Other towns that you request money from that do not fund you?
Very few. We've actually started to expand our list of, we have funds from about 50 municipalities.
The Lakes region, I think everybody.
Yeah, I apply for funding for communities where we're providing significant service. You know, if it's a community that we aren't doing a lot with. So for instance, up this way, Bristol. We haven't provided very much service in Bristol in the last couple of years, and so I've stopped applying to the town of Bristol. I don't think it's fair. You know, but in Tilton, Laconia, Meredith, Gilmanton,
Northfield.
Guilford, Northfield. Yeah, next
Does
week we go to
Northfield fund you?
Northfield. Yes.
How about you, Franklin?
Franklin we are applying to this year. We had not applied to Franklin in recent years. We hadn't applied to many Merrimack County towns except for Northfield, and I think Northfield is considered more Lakes region. They're a twin to you guys, and had, even though they're in Merrimack County, they've always been a town that we applied to. Franklin was in the Greater Concord catchment area for United Way, and so because we got a United Way grant, we felt that covered counseling, Camp Spalding, but the funding from United Way has really eroded in recent years as they've changed their scope, and so we've started to reach out to some of the Merrimack County towns. I'm going to Henniker on Saturday, and I've applied to Boscawen, which is adjacent to Camp Spalding, and we provide an enormous amount of service to that community, so.
So their money stream was actually coming through the United Way in the Merrimack County. That's where you were getting your money, where the smaller towns in
Right.
Laconia, where the Lakes region, we don't get into the United Way
Right,
catchment area
And we don't have any money from the Lakes Region United Way at this point at all.
from the money stream, okay?
So they funded our family counseling, some of our family counseling program. So,
We used to have county money in Merrimack County
Right.
as well.
right. So we are starting to reach out to more Merrimack County towns.
Have your services increased, stayed about the same, or decreased over the last year with Tilton residents?
Tilton has increased this year, and so has Meredith and Laconia and Northfield. I think more people are needing mental health assistance, and they don't qualify for the mental health center.
Is that a result of the economy,
Yeah,
you think?
yeah, it is. The recovery for, people at the bottom recover last, or never recover. You know?
The mental health centers have
And-
cut way
and the
back
mental
on
cen- yeah,
eligibilities.
mental
That's
health-
pretty common
Yeah.
in the news, all the financial stress they've been under. So that kind of trickles back to us, people looking for
Well, it's also because the third-party providers now are concerned about where their money's going to be coming from
Right.
with the Affordable Care Act and whatever, whether they're going to even be able to provide services, because their main funding stream comes through the either federal or state, and they get their money through grants from each other. And a lot of the third-party payment providers are really concerned that they're not going to be paid.
I think we forgot to introduce Sandy Plessner, when the selectman was diligently here. And so, you didn't meet with anybody from Child Family Services yet, did you? Or the selectman? So I want to make sure.
Selectman hasn't.
Yeah. So,
You're in our welfare office?
She's a selectman.
Selectman, okay. Okay, Selectman Budget.
yeah, we're...
Except for
we actually-
Catherine, which is both.
Okay.
Yeah, we all...
Henniker's gone to your model. I'm very delighted to hear that, because I used to go to Henniker and have to go to the Selectmen, and then go to the Budget. And then if they said no, you could go for reconsideration, and you'd have to do it all over again.
Well, it works out great because we all hear the same information at the same time, and it saves your time.
Excuse my back, Sandy.
That's quite right.
So,
Do you have other, I brought Tony, so do you have other financial questions?
yeah, that's... What is assistance to individuals on the...
That could be anything from rental assistance, utilities, food, things like that, that we pay for on behalf of.
Do you guys do anything with, like, the courts or anything
Yeah.
with the kids that are involved in courts?
Yeah,
Get them back on track?
The Parent Aid Program, which is one of the two which represented here, is a DCYF preferred program for families that need supervised visits, things like that.
Supervised
And a lot of our home-based programs are either court-ordered through juvenile justice or DCYF referred programs.
The tracking program that I mentioned
Yeah.
earlier, which is part of the IHB cluster of services, that's court-referred. Those kids are adjudicated, and they're ordered to be followed. Our boss can, once in a while, will refer to that as private probation. It's not really probation, because they don't want to get the kids into that system, but it's to track their movements, to make sure that they're where they're supposed to be and doing the stuff they're supposed to be doing, rather than the stuff they were caught doing.
So you're actually fulfilling the role of the Chins petition, which is now null and void in the state of New Hampshire.
Child Data Services.
Oh, God.
Did they bring it back?
Yeah.
Oh.
Not fully, but this past session of the legislature, we worked very hard on that. Part of our mandate as an organization not only is to work on changing families' lives and improving the lives of kids by direct service, but it's through public policy that impacts families. And so we worked really hard to get Chins restored. We took testimony, we had stories of all the kids that were really suffering because, and the police who were just so upset that they had no authority to do anything with these kids.
So that has gone through the legislative
It has gone
process?
through the legislative process, and I think $8 million was...
Seven, I think,
Seven
yeah.
was restored? Okay.
I think it was 7.
So we're now going to be able to serve about 600 Chins kids a year, and when it was more fully funded, there were up to 1,000 kids I think, that had been served. But when all the money was cut, you could only serve 50 kids.
Don't you also have a substance abuse program for young
do.
people?
Yeah, we have an outpatient adolescent substance abuse program, mostly in the Manchester area, but we used to have a grant in the Lakes region. It was a 5-year grant from New Futures, and we were doing a lot of work in the schools in the Lakes region. The program was ending as the economy was crashing, and when we went to the schools and went to the towns trying to get some funding to keep it going, we were not successful. We wrote a few grants and have been able to keep a couple of hours a week, but not doing the kind of outreach and the kind of work in the schools that we should be doing, because we know that there is a big problem, not only in the Lakes region, but statewide with kids and substances. I know that it's a real prickly issue up here.
Do you work with the youth assistance program at all in Tilton?
I don't know that. I can find that out. I'm assuming that our staff does,
Okay.
but I don't really know.
The youth assistance program is pretty well self-sufficient.
Just looking at-
Would there be referrals back and forth?
There could be, that's why I asked.
They
if you
usually
did.
work more with the program in Laconia, the district court. I can't think, Judge Jewett's created it, what's he call it?
Restorative justice.
Restorative
Oh,
justice.
restorative justice, yeah.
Their adolescent drug program, I think they have to go to Concord.
I had a question on the financials here. The second column says year-to-date budget as of 8/31. Is that the total budget for the year?
So that's prorated for 8 months. We were on a calendar, our fiscal year's calendar year. So
Oh,
that would
okay.
be 8 months worth. And then if you compare it to the proposed 2014, it's 200 year-to-date and 300 for a full year. So.
Okay.
Do you get money from the school system as well, or no?
Not any school systems up here. We do in Portsmouth, Raymond, and Lebanon. A couple of school systems that we actually serve as the SAP for the student assistance person, but the only funding we had for school work up here was through the New Futures grant. And the donation.
Okay, anything else, or? Sandy, how are you doing? Yeah.
Good
Hot
presentation.
Off the Presses is our newest newsletter.
Super.
I brought a few. I'll leave them with you. Good bedtime reading.
Would you like one?
The feature is about our homeless youth program. And
Thank you.
Let me hand that back over to you, because these things cost money, so.
She's gonna say those.
I brought them for you to keep in the town.
Oh,
Yeah.
And I don't know whether the welfare person
Yeah.
or the,
We can
I
give
think your
those to
welfare
Heather.
department should have,
Heather,
yeah.
Yeah.
enjoy those. And
So I asked for
Those
Joyce,
two.
because I haven't seen Joyce for a while, or any ages, and I know that she's here.
She's our town administrator.
Yeah,
That's right, yeah.
she's doing great. She's-
Well,
The town runs on her back.
I go way back with Joyce. She and my husband and her ex used to work for the Community Action Program, Belknap Merrimack County Community Action. And so, after I was here last year, she sent me a little note and said, I couldn't believe it was you, and I didn't. So, say hi for me.
No,
will.
she's indispensable here.
You've got a good catch.
Excellent.
Thank you guys for what you do.
yeah,
Thank you.
very important work.
Thank you
Time
for
tonight.
And I am glad to hear the Chins is finally
back.
coming
back.
back slowly.
State's really being stingy about allowing us access, though. I think we've had, a handful of referrals.
Right.
It started September 1st, and we've had
There's a
handful.
we have a, kind of sad around our places these days, because we have a long-standing program that you've used before and that Laconia uses. We have a group home in Concord that deals with kids who've been removed because of abuse and neglect, or because they're adjudicated, and the state philosophy, and I guess it's kind of all over the country, is to try and keep kids within their own communities, their own homes, and they're not referring to the residential programs. And we're closing our group home at the end of the year.
I think some of it may be an awareness piece that Chins is back, because this is the first time I've heard it.
Yeah.
I certainly will let YAP know, and they will let the schools and local PD and our Judge Nate Gordon over in Franklin know that this is out and running rule.
They know,
But
they
he-
know.
But you have to prompt, you have to push sometimes to get them to realize that they should be using the program. Because part of the YAP program was, we talked about chins, and the
Yeah.
concern that our local PDs were having, including our school resource officer, that he was not having the materials that he needed to make some of these corrections, and that's good to hear. Thank you.
Yeah, thanks for coming, very much.
I like coming here because you all are so knowledgeable. You know your community, you know the services, and
Some of us are learning.
well, you've got some good teachers.
But what we've heard, what I've heard, and people have talked to, and what I've read and learned, you're well respected.
Yes.
Thank you very much.
Thank you very much.
Good to see you.
Good to see you again.
Okay, thanks.
Good night.
Okay. good people. She you ran out of chairs. She,
Keep your place right.
actually, we can squeeze Sandy up here. She's all by herself out there. Okay, the next thing on the agenda is Franklin Visiting Nurses.
There we go. Good evening.
And Sandy, you're more than welcome to pull up for, you want to squeeze it? Okay, you got a little setup there.
Directions tonight,
Yes. Yeah.
No, it's, I didn't even see, what does it say?
Says, please hold the mic in your hand and hold to your mouth. You can probably do it.
Are your select board meetings getting a little...
Okay, excellent. Well, we had you here, there's a few new members.
Okay.
You hear when everybody introduce themselves, or you want to? Yeah.
Stanley?
Hi, John Bossy.
Jane Alden.
Hi, Jane.
And I'm John Scanlon.
Wayne Brock?
Eric Byron?
Catherine Dawson.
And
I'm Jane White. I'm the Executive Director at Franklin DNA and
And
Hospice.
Sandy Plessner is one of our selectmen, so that we save you having to make 2 trips or anything, we all meet together.
I appreciate that.
And we forgot our heart and soul, sir.
And-
Sitting over there is Joanna.
She puts it all together.
Well, first, I'd like to thank you for having me here tonight and for the opportunity to be able to talk to you a little bit about the services we provide. For those of you who are new here, you may not know or be familiar with home care services. We provide skilled nursing, physical, occupational, speech therapy. We have home health aides that provide personal care, and we have a homemaking program that provides things like grocery shopping, picking up prescriptions for people, doing their laundry, some light housekeeping, and so on. So that's kind of the nuts and bolts of who we are. This year, we're requesting the same, I put the same funds as last year. It's $30 less, I think, but I'd like to round off numbers. The requests typically are based on the services that we actually provide to the town, in addition to essentially what your population base is. Around 80% of the clients that we serve were reimbursed under the Medicare program, so you know that bulk of our clients that are either over 65 years of age or they're disabled in some way, shape, or form. Our reimbursement is very different than any other kind of business. In the home care program, patients are typically, we're reimbursed under the Medicare benefit for a 60-day episode of care. Doesn't matter how many visits we provide during that period of time, as long as we provide 5 or more, you're paid based on a person's kind of acuity or how sick they are over a 60-day period of time. If we provide less than 5 visits, they do reimburse by the visit. The hospice program that we have, where all those services can be provided under the hospice program as well, that's actually reimbursed by the day. And in that are all the visits that we provide, also all the medicines that the person would take that are related to their diagnosis, their hospice diagnoses, and all their medical supplies. And recently, we've had a couple of people who have actually been under our hospice program that have been hospitalized for extended period of time. So we're required to participate in paying most of the hospice reimbursement, hospital reimbursement. What else can I tell you about us? Reimbursement under private insurances, under Medicaid, and private pay are all below the cost of providing the service. which is an issue I hope at some point in time our government really looks at, especially the private insurances. You know, I really think where they are very profitable every year, but yet they don't even cover our cost for us to meet their needs. And obviously, we want to see people in the community, and we do. So we certainly take, reimbursement for any insurance plan, and we have multiple contracts. But we actually look to the Medicare program. I mean, that's our hope, to actually have a positive bottom line, is through Medicare. The Medicare program, I know I talked to you about this last year, we were looking at sequestration, the possibility of that. That did take effect starting at the beginning of April this year, and that's because our federal government did not come up with a budget that they could agree on. So that means that every service we provide under the Medicare program, we get a 2% reduction in what our reimbursement would have been under the sequestration. So until they come up with this balanced budget and agree, they'll continue with this 2% reduction. They're also looking, unfortunately, at further changes in Medicare reimbursement for home care specifically. The proposal right now is that they're going to reduce our reimbursement 3.5% every year for the next 4 years. That totals a 14% reduction, and that comes on top of, we've had a 20% reduction since 2008. So to me, that's pretty scary, because everybody says if they want to be taking care of people in their homes, they're trying to reduce the length of hospital stays, do all these outpatient services now. People should be managed in the home, but yet they're really reducing our reimbursement based on that. As part
I
of
think
the-
that's particularly scary to a town like Tilton, where we have an aging population, and we're not getting new people in.
I mean, that's kind of the situation in most of New Hampshire.
Yes.
As part of the Accountable Care Act, they've also proposed that Medicare beneficiaries would have to pay a $100 copay for every episode of care, and would be 5 or more visits. If we provide 5 or more visits in 60 days, each person would have to pay us a copay of $100, assuming that they were not hospitalized prior to that episode. So if they're hospitalized, they wouldn't have to pay the copay. If we get a referral from their physician's offices that these people need assistance, or if they had outpatient surgery and they want us to see them following, then they would be responsible for a copay. And I'll talk a little bit about some of our clients and their income in a few minutes. I'm leading next into the Homemaker program, that's the primary program that we really lose money for in the agency. And we're really trying to tighten our reins, believe me, on this program. But that continues to be an issue for us. And for that program, they're typically, people over 65 years of age, or people who have disability. This is income qualified for this program. There are 2 grants we get funding under. One is Title 20 and one is Title 3B. These are both through the state of New Hampshire. They fund them about at half the cost of providing the service. So we do have a grant that we get from Merrimack County, for Merrimack County residents to help supplement that. We have applied for United Way grant. We did not get it last year. We did the prior year. They had reduced the amount of money, but we did get it the prior year. We did not get it this past year. We're in the process of applying for it again this year to supplement this particular program. We do have the option of charging the people under the Title 20 program a copay. So I've been looking at that because many other agencies that provide the service do charge a copay for the clients. So the range, again, this is income-based. The range for the income of our clients goes from $207.50 to $1,100 a month for the clients. The mean of that is $764 a month. The average is $794 a month. Just over 50% receive less than $800 a month. Visits are typically once a week. So, I brought this to the board and we talked about this and feel that we just can't charge these people a copay. We have a neighboring agency that actually charges $10 to $12 a visit as a copay. And we've opted not to do that. So every year, the agency, even when we get funding from towns, the agency still has to contribute money to support this program, which we do. But that I want people to know about those figures because it was really scary to me. I mean, think about what people are actually spending in our community. We do ask clients for donations for last year, and what we're predicting this year is about $3,000 a year.
How much?
We get $3,000. Some of the towns have asked me for financial information on what we might write off to clients in the town. So I went to the finance department, and they gave me some numbers this is from October of 2012 through September of 2013, just so you have a sense. And these write-offs would be for people who are private pay patients or who have a copay, because a lot of the private pay insurances now have copays, and people do not like to pay their copays because they don't think they should have to pay the copays. But the actual write-off so far has been about $1,000. However, our potential write-offs for the same period of time, so these are accounts that are unresolved right now, is over $11,000 this year. So we don't know if we're going to be able to collect any of that money or not. We have never used a collection agency. We really don't want to head in that direction. There are healthcare facilities that do. But that's where we stand right now. So what are we doing? I mean, we're experiencing a lot of cuts. We're trying to make a lot of internal changes. We're looking at all our internal processes to see if we can be more efficient and more effective in what we do and how we provide care. We're looking at all our internal jobs to see if we're doing the right things, we have the right people doing the right things. We're adding new technology. We've had electronic medical records for several years now, but we continue to upgrade those as we can. We've had to purchase and/or upload, depending on the program, new software for billing. Because all the billing programs have changed. Medicare has changed, Medicare has changed, the private insurances have all changed how they're doing their billing. So we have to either buy software to be able to support that, to do electronic billing, or in some cases it's free. We just have to upload it and do training for the staff on that. Also, we're trying to improve access for our staff. We have a nurse on call 24 hours a day, 7 days a week. We also have an administrative staff person on call 24 hours a day, 7 days a week. So if the staff person runs into a situation that they're not sure how to handle, or there's too much of a workload that's been added all of a sudden that they can't handle, they'll call the administrative person. The administrator has never had access to the client data at home. The on-call nurse has. So we've recently added a laptop for the administrator to have at home, and they rotate through whoever's covering for the administrative group to be able to access client data so we can be sure that we're giving the right answers. We're also participating around information with the New Hampshire Health Information Exchange. So I'm not sure how familiar any of you are at this point in time. So we're working with them in trying to figure out a mechanism for our agency to be able to participate in an information exchange. So if we get a referral from a hospital, they would notify us we have a referral, we would go to the information exchange to be able to get that data. So that's going to eliminate all the faxing that we get for client information. And believe me, we get loads. We go through reams and reams of paper for client information and so on around that. But it should make it easier to have an exchange with the patient's approval and, limited access. I can't access any information about an individual. It would just be what another person needs to send us for services. Also, we've been working with all the staff so that they can actually upload and download their data on their tablets from their homes. So that's a big deal also, because otherwise the staff has to come into the office to be able to transfer some of the data. And if they're at home and get called from a patient that they've never seen before, we don't want them to have all the patients on the agency on their tablets. So now they have the ability to be able to just download that information if they need it. We're also trying to do more with education. As you all know, this is a world of change. It's a world of change in healthcare. There's new technology all the time. There's new equipment and supplies all the time. And we have to keep the staff educated so we can provide quality care to people and the clients. I am very happy to say that we have nurses that have received certification they're not all certified in all these things, mind you, but in hospice, in the OASIS C, which is our government-required assessment that we have to do on admission for people. We have a nurse certified in Alzheimer and dementia care, another one for IV therapy, and we have 2 in quality improvement that they've just done. So all those things obviously cost money, but they're really necessary to keep up with quality care we need to provide. We're also part of what we call the Rural Home Care Network, which is all the smaller home care agencies that have joined together to form a network. We've actually applied for a grant to see how best we can work together. We're looking for ways to maybe share staff or share some of our services to be able to reduce costs for all the agencies across the board. So we're hoping about that. We're also part of the Care and Community Network of the Twin Rivers, which I'm sure you're familiar with. I'm on the board of Care and Community Network of the Twin Rivers, and happy to say I was on the board in the late 90s, as a matter of fact, too, when that was first set up and established. So we're working as part of that organization to improve health and wellness in the area. And also, we're part of the new health district. So CCNTR was a health district with kind of the Franklin-Tilton region along with the Newfound region. The state just changed our districts a few months ago, so now Newfound's cut off and they're part of Plymouth. I know. Tilton Franklin area is now part of Laconia, and they took part of the other Laconia district and moved that elsewhere. So we're trying to figure out how we're working together. So we've had a couple of successful meetings, actually. We're pooling the needs assessments that both organizations have done to figure out what it is as a group we're going to be able to focus on. But I think there's a lot of promise with that organization. And because this is kind of I don't think it was part of their plan, but it's actually one good outcome of this is that the population now for this health district is over 75,000. It's around 78,000 actually for population, which means that we can apply for a lot of other federal grants that we did not qualify for before. So we have a smaller population, so we have to be hopeful that that's going to work out. And also, obviously, we're certainly willing to work with towns, whatever needs you have around healthcare for individuals in the towns. So thank you again for the opportunity to speak to you. I'm sure you probably have some questions for me, and I just want to say that we're actually going to have an open house. November happens to be Home Care and Hospice Month. Yeah. So we're going to have an open house on Tuesday, November 19th. It's 2 to 4 and 5 to 7 p.m. You're all welcome to join us. It's open to the public. I have no idea how many people we will entertain. But I'm really hoping to bring people into the organization so you can see who we are, meet some of the staff, ask questions, and hopefully we'll figure out other ways to work together.
2 to 4 and...
2 to 4 and 5 to 7.
And to 5. And where is that located?
We're on 75 Chestnut Street in Franklin.
A couple of questions for you.
Yes, I'm sure.
With Franklin Regional Hospital changing its philosophy and doing short-term care for more of the elderly, Medicaid, Medicare-based patients, and adding the psychiatric wing that is now up and functioning for short-term stabilization,
Right.
as they're calling it, for relocation back into the community, do you foresee that impacting your program?
Well, that's a good question, because one of the programs we're evaluating right now is whether or not we want to do psychiatric nursing. For patients who are, if they're able to go into a practice, then we have Riverbend and we have Genesis locally, and they do mental health counseling. But for individuals who are really homebound and can't get out, is this some kind of a service that we want to be able to offer? So I do have a nurse that qualifies as this. We've never offered it as a separate program. Reimbursement is very different, and how that has to be structured for referral and so on is very different to get that up. But that is a piece that we're looking at right now.
Because I know that the hospital is one of the main provider of referrals to your program, and as they change, so is your program have to change to meet their needs. And they've consolidated. They took Westside Health and brought them up to the hospital, and so they're consolidating and making a more local base. So that means the impact on your organization will be to provide more services for less money. Okay, correct?
I don't know if it'll actually be less money or not. We don't get reimbursed by the hospital, remember?
Right, but they control the Medicaid, Medicare, the initial stages of how that comes through.
Remember that, and I believe this is still in the case, that the providers under Lakes Region General Health Care do not accept Medicaid patients. right?
For now.
So, for now. I mean, they gave that up for a period of time. So there are places like Health First, which is a federally qualified health center. They're reimbursed at a much higher rate. I mean, we lose money on Medicaid patients. The
Yeah.
hospital loses money on Medicaid patients. The federally qualified health centers make money on Medicaid patients. So it's different. So they've actually picked up the bulk of the Medicaid patients. We still service Medicaid patients, certainly. But ultimately, how that will impact us, I'm not sure. When you talk about changes in the Medicaid program, there are now the 3 managed care Medicaid programs that people are being enrolled for. And if people who receive Medicaid don't enroll in a program, they're going to be automatically enrolled in one of the programs. Like that. So how is that going to impact us? We don't know. If they expand Medicaid, that's a whole other piece of the population that will now qualify for reimbursement, but it's also reimbursement at a loss for us. How is that going to impact us? We don't know yet. I mean, we really don't.
The other question deals with dementia. Dementia we're having an aging population, which I am very proud to be part of at this point in time. But
I'm not sure I'm proud of it, but...
Oh, I'm always proud to be old. Part of the question would be around dementia, because we're talking about Alzheimer's, which is the initial stages of dementia, which is a very costly, long-term, chronic process for in-home care. Do you provide, what length of service would you be able to provide for those that are going through the different stages of dementia?
It depends on the individual and what their particular needs are. So primarily, again, because of this particular population, the reimbursement is under the Medicare program. Medicare does not reimburse us for chronic care. So as people have acute care episodes, then we're able to provide service during those periods of time.
For 60
But not
days.
for a number of years straight. That would be very unlikely. We used to be able to do that under the Medicare program, and that was changed a couple of years ago when they redefined who qualifies for services.
And that would necessitate separate billing for each one of those acute stages as you're going in for the disease. Okay. Which is really a duplication of effort, because you're doing the same services, but you just have to create the new bill to provide.
I'm not sure I really understand exactly what you just said about the billing episode. We bill for every 60-day episodes. We can recertify after a 60-day episode of time, as long as they qualify as we're providing a skilled service. Once they really become chronic care, so we're not able to improve their condition or improve how their caregiver is providing service to them or help them in other ways, then it becomes chronic care and we can't provide service. But as the person's condition changes, we can then go in the home and we can suggest ways that the person can be managed. We can supervise how the medications are, how the person is responding to medications at that point in time. We would have a skilled service under another period of time.
So you're able to recertify instead of the primary provider?
We actually do it together. In order for us to
Okay.
provide services, we have to have physician orders.
So literally, you go back every 60 days to the primary care physician, who then either says yay or nay to a continuation of the next 60 days' worth of services. Okay.
Eric? I guess we'll go around. Sandy, did you have anything?
No, I'm taking it all in so far.
It's kind of an information overload. I apologize for that.
No,
What
But
you
there's just
provide?
so many changes that happen and how we're being reimbursed.
What's home health supervision?
Home health supervision, every 14 days, we have to send a registered nurse out to supervise a home health aide. So whoever they're providing care to, whatever patient it is, they have to have a supervisor visit at least every 14 days.
Do you expect any major changes with the swapping over of insurance policies during this Affordable Care Act process?
Absolutely.
Nobody knows.
Positive
We
or
don't know-
negative?
Well, we don't exactly know what's going to happen. I mean, right now, like a lot of we have contracts with the private insurance companies, and those are changing. We know Medicaid reimbursement is, not the reimbursement itself, that hasn't changed, unfortunately. But how that is going to be managed is changing.
Because New Hampshire has both their own exchange and the federal exchange that they can be working from, right?
I thought the federal exchange worked kind of through the state.
some of it does, but there's also I think it's Anthem that has the New Hampshire exchange. And then the federal government, you can go to that website that does not work and create your own policy.
Anthem really is, I mean, it is the private insurance provider for the most part in the state.
I
Right.
think it's the only one that's
Stan, did you have any
going
I mean,
questions?
MVP just pulled out, we just got a letter on that.
In your spreadsheet of revenue,
Yes.
where did our $15,630 from last year, what section is it? Grant
The
income?
money from the towns, is that what you're asking about?
Like, how do you break, what is home care program? Is that reimbursements from insurance companies like we were talking about, things like that?
It is.
If you could just break down that column of what those different things are.
Let me see what's up there. Excuse me for a moment while I fish through to find a better piece of paper here.
Last year's, for telephone.
No, I have the copy of that.
Yeah.
No, I have a further breakdown that actually we use on a monthly basis. I have a copy of it with me tonight.
No,
It
that's
actually
okay,
breaks all
just in
that
general,
detail.
where would our money land on your spreadsheet?
Right. I guess primarily it's going to be under the home care program. The home care program, although it's called home care program, I mean, that's home care, that's hospice.
And
Kind of in a lump sum.
So how much, what percentage of that comes from local municipalities?
Let's look in another place. From towns, we receive approximately $58,000.
Okay.
Okay?
All the towns in New Hampshire? Are you regional?
We're regional.
Yeah.
We provide services to Franklin, Tilton, Northfield, Belmont. We do a little in Laconia, but not very much in that direction. Sandminton, Hill, Salisbury, Webster, Andover. We do a little in Boscawen and a little in Canterbury.
So just to round the numbers off, at a $60,000 for local municipalities, we would be considered about 25% of it?
And that's primarily based on service. I mean, our primary service area is Franklin, and Tilton is number 2.
What percentage of your budget do you get, of that $60,000 do you get from Franklin? Sorry.
We get, I said 60, it's just under half.
The only question I have is just where it landed.
Sure. And I will verify that when I look at it. I have a different sheet here that it was in there. And if it's any different, I will follow up with you.
Are the services costlier the farther out you go from the headquarters? Let's say that you have to go to Andover.
Well, we pay mileage to
That's what I
staff.
was going to say, mileage and time. So you may only have two patients in Andover, but they may cost more than 3 patients in Tilton.
If you want to break it down for that kind of thing, yes.
Yeah.
I mean, typically, like when we have our annual audit, the auditors figure out what our approximate cost is per visit by each discipline and so on. They don't break it down by town, but...
Anything else? Yes, that's fine. You mentioned something about, let's see, working with Genesis and, what else do you work with for mental health?
Well, I said for mental health in the area, there is Genesis and Riverbend that do counseling. So I've already met with people from Riverbend because we're considering maybe doing a psychiatric nursing program. Because I don't want to take their business by any means.
Sure.
But if we can provide it to people who are homebound that they can't get to, I think the community would probably benefit.
Did you ever work with Genesis at all on anything or collaborate?
We have
or
common clients.
common clients? Or do you have to, like, report back to them on anything, or?
It depends on what it is. Usually they monitor their clients very well, but sometimes, yes.
Yes.
How many staff do you have?
We have around 36, 37.
Are they all like RNs and?
They're registered nurses, physical therapists, occupational therapists, speech therapy we actually contract for, home health aides and homemakers, and then there's office staff. So you have to come to our open house.
I think I will.
I hope you're not the only one there. I'm getting nervous.
No, I would just say that I've had the opportunity to use your services twice.
Oh, you
For
have?
my brother who had leukemia, and my father who was stroke, neuro, whatever, and services were good. They were there, provided the services that were needed, so I much thank you for those services.
Well, thank you. Thank you for your kind words. And if you hear anything unkind or there's something that I need to be aware of, please contact me. I mean, we do want to provide quality care for people in the community. So if there's something hanging out there that's questionable, please call me so I can either clarify that or correct it.
Super, thank you.
Thanks for any of you.
I work in a facility, nursing care facility, and there's a book that went around where I work, and there was a phrase in there about nurses. They said that doctors keep you alive, nurses make you want to live.
I'll have to remember that.
I had an occasion this past year to be with someone who was under your hospice care. Started out with Laconia, visiting nurses, transferred to Franklin, and I can't say enough about the professional staff that came and the volunteer staff as well.
Thank you.
Okay, well, thank you very much for coming down.
Thank you.
That's always.
Thank you.
As us all.
The same to you.
Okay. So that's all we had on the agenda for this week. Was there any other business?
I would just like to say, I would like people to look at the reply I got from Jim Doan over at the Recreational Center. There was a question on how many scholarships were given and the amount of that scholarships. He did provide that information, and
That was
I think
just sent out around the other night.
Yeah, Joanna is sent that out. I have also asked Winnie Transit a couple of clarifying questions in regards to, I was having some concerns about the $65 that was the actual cost of that. Asked them to explain and break that down. The other question I asked them, what would be the impact of whether we funded at $5,000, $2,500, or zero upon that, and what kind of adjustments the actual adjustments they would have to make to their program based upon those different figures. So hopefully.
Did you get an answer on that one?
That is-
I saw the other answer.
That was, I called them today, and for some reason, my wonderful provider, we won't mention Verizon, had decided to change the wires up here on Route 3 and cut my service off halfway through the phone call. So I went to another provider, we won't talk about NetPoint, and actually emailed them, and they have promised to get back to us by next meeting. And as soon as I do get a reply from that, I'll get it to Joanna, who will then use the system that we have to get everybody those answers so that we can make an informed decision on where we want to go with them.
No, on Jim's, I noticed it was, now, the number that he gave, was that for 2013 or 2012, 2013?
That's a good question. I
Because, yeah.
have to clarify that with him.
Yeah, see if it is,
I will
you know,
clarify.
or how much was
Number
breakdown.
61 was just a rough number off the top of my head. It's not like anything is going on a spreadsheet that he came up with. It was just one of those, well, how many riders? I think it was 5,000 riders by X number of budget. It was
Right.
just a rough number.
I think it was a legitimate question to ask, because if they're collecting $1 per ticket, and it's really costing $65 per seat for that to occur, or anything close to that, then we should know why there's such a big discrepancy between the two prices, and that will also look at the impact. So if they come back, as I said in your presentation, I think the memo said that, you said there would be no appreciative difference, or maybe that was part of the phone conversation we had.
No, they
No,
said that.
that was part of the phone conversation before we
They did say it here.
got cut off. Then why?
Yeah.
Yeah, then that's hopefully where that, we'll get some reply, and I will make sure that I continue to get to them until we have that email.
I appreciate it.
Sir, if we're ready, I would like to vote. I would like to make a motion that we recommend to the town of Tilton for the Fund Child and Family Services at $28.50.
Second.
Second that.
We have a motion and a second to fund Child and Family Services and the $28.50, which is what they asked for. Any discussion on that? Okay, we'll call it.
What about the idea of the town wanting us to level fund? Does that have anything? I thought the idea of the budget this year was to level fund.
That is what they requested last year.
It is.
Requested in 2013 is $28.50.
Yeah,
The amount approved, looks like we dropped it to $2,500. But their request is level funded.
You could amend that make a motion to amend the amount if you wish,
No, I'm just
or
asking.
if anybody else wishes to. Okay, all those in favor to fund Child and Family Services at the amount of $2,850, say aye.
Aye.
Opposed? And so moved.
I also make the motion that we ask the town of Tilton to fund the Franklin VNA and Hospice for the amount of $15,600, which is level funding from last year.
I second it.
We have a motion and a second to fund at, say, $15,600. Any discussion on that? None, call the vote. All those in favor say aye.
Aye.
Opposed? None. So moved.
I love motions.
Let's see, what else we have left here? Just looking. Next week, we meet with, oh, my calendar.
Library.
The library.
That's it.
Okay.
And I'll report on those two that are outstanding.
Let's see what we've got.
I think an original schedule in recreation council, didn't change.
Yeah, they,
November 20th.
Library and Rec Center Pines.
According to what you told me, it's 11:20?
That's 7:50.
Because they had been 11:13.
yeah,
I think they requested
20th.
to move.
Yeah, they requested it to change.
Everybody gets their own library books,
She's really done some good stuff with it.
Okay.
If there's no other business, sir, I make a motion that we adjourn for the evening.
Second it.
Motion and second to adjourn. All those in favor say aye.
Aye.
Opposed?
Make that
So moved. Okay.
It's really weird.
Sandy.
Lost my paper. No, I know I put it in here because I remember snapping at one of these,
Why, are you gonna say bad words? Is that why you want?
but I put the date up there in green. This is